In this class, I will be discussing what we know about the effects of chiropractic care on low back pain and neck pain. I will go through both of these topics separately and discuss what we know about them and how and why chiropractic care could help people who are experiencing these problems. A common reason why people seek chiropractic care is when they are experiencing spinal pain, particularly low back pain. In fact, low back pain is now the leading cause of disability worldwide. That is a huge problem. Low back pain is so common that most people will experience it at some point in their life. So why is this such a common problem? Are all of these people injuring their back? While some people do get low back pain from an injury, that is not the case for most people. And this is part of the reason why it can be so frustrating for people, because the exact cause is hard to find. What we now understand, though, is that low back pain is usually caused by problems with how the spine is moving and functioning. To understand this better, let's take a look at the anatomy and function of the lower back. Low back pain is defined as pain felt from just below the ribs to the buttocks. This part of the spine is made up of the 5 lumbar vertebrae and the pelvis and sacrum. The lumbar vertebrae are the largest of all the vertebrae in the spine. They support the upper part of the spine and connect to the pelvis and sacrum through joints. The lumbar spine bears the most weight in the spine, reflected by the larger size of both the vertebra and the intervertebral discs, which act as shock absorbers. The anatomy of the lumbar vertebrae allow for large degrees of movement in flexion, extension, and side bending, but not so much in rotation. There are also numerous muscles that attach to the lumbar spine, including the core abdominal muscles, which play an important role in keeping our spine stable and our body upright. Spinal nerves also exit the spine through small canals between each vertebrae and extend to provide neurological input to muscles, abdominal organs, and the lower limbs. With such a significant role in weight bearing, core stabilization, neurological input, and movement of the body, it is no wonder that the lower back can be prone to developing pain and dysfunction. Combine this with an increasingly sedentary lifestyle, abdominal obesity, and poor posture, and we have a pretty good explanation for the worldwide problem of low back pain.